According to a study by Mintel conducted in 2014, sales of gluten-free foods have increased by 70% between 2012 to 2014. However, only 1% of the population in the United States is diagnosed with having celiac disease or having gluten allergy. And this number has not increased over time. So cutting gluten out of your diet can be beneficial even if you don't have celiac disease. I've personally seen the positive effects that a gluten-free diet can have on someone. Previously, I had stomach problems, I had skin problems. I went to the doctor, I went and saw a nutritionist. They tested me for celiac disease. I luckily don't have it. I do, however, have a gluten intolerance, meaning that I'm not allergic to it, but my body doesn't really like gluten, if that makes sense. So now all the problems that I had before with my stomach and my skin are gone, which is amazing. So, I've had positive results, and I hope that if anyone else is having these same issues, they definitely look into it and see, what's out there for information. So remember to consult a physician before making any changes to your diet. That's very important. Throughout the next few minutes, I'm going to inform you about what gluten is and what foods you can find it in, the difference between a gluten allergy and a gluten intolerance, which I've kind of already touched on, benefits of going gluten-free. So 29% of Americans say that they are going gluten-free for health reasons. What is gluten? Gluten is a protein that is primarily found in wheat, rye, and barley. So wheat is found in foods like pastas, bread, baked goods, soup, cereal, sauces, just to name a few. Barley is found in beer, soup, food coloring, and malts. Malt is, of course, used to make things like malted milkshakes, malt vinegar, and malt flavoring. Rye is, of course, found in rye bread, so like pumpernickel, for instance, rye beer, and cereal. If you're going gluten-free, make sure that the products you use are specifically labeled gluten-free, because gluten can be found unexpectedly in foods for various reasons, like for texture, or gluten can be used as a bonding agent, or a product to help food rise during the baking process. A gluten-free label also ensures that no cross-contamination occurred at the facility or factory it was made. Now that you know what gluten is, I will tell you about the difference between having a gluten allergy and being gluten intolerant. Okay, so celiac disease is a serious autoimmune disease that affects both men and women. So basically what celiac disease does is it affects the ability of the small intestine to absorb nutrients in the food as it passes through the body. So I have a visual aid here from glutenfreetherapeutics.com. So on this side here, you can see that that's a normal, what the normal small intestine is supposed to look like. It kind of has those feelers on it to help absorb food as it passes through the body. And then you see a celiac disease damaged small intestine. So it looks like it'd be pretty hard to absorb nutrients with a damaged small intestine, which it is. So the only cure for celiac disease at this time is to go on a 100% gluten-free diet. So all those things and foods we were talking about before, they cannot have them if they contain gluten. So there are no pharmaceutical or therapeutic remedies or cures at this time for celiac disease. Celiac disease can also cause things like infertility, neurological disorders, depression, can give you symptoms like ADHD as well. There's a lot of cases of undiagnosed celiac disease or underdiagnosed celiac disease. So that means that on this visual aid here I have from beyondceliacs.org, you can see that 83 out of 100 people have misdiagnosed or underdiagnosed celiac disease. So that means that they go to the doctor with some of the symptoms we talked about earlier, like stomach pain, rashes, something like that. They are seeking out help from the doctor. and the doctor tells them you have a stomach virus or you have psoriasis for their rash, which could really be caused by celiac disease. So, it is estimated that the diagnosis rate may reach up to 60% by 2019 because of all the increased awareness about celiac disease and gluten intolerance. So, gluten intolerance, also known as non-celiac gluten sensitivity, is what I have. So, it's, you fall into this category if when you don't eat gluten, you feel better, essentially. So some of the symptoms you can have if you have negative effects from gluten are bloating, foggy mind, depression, abdominal pain, constipation, headaches. If you feel any of those things, you should go to the doctor and get tested for celiac disease. If you don't have it, you might want to talk to them about cutting gluten out of your diet just to see how you feel. Now that we've talked about what celiac disease is and about gluten intolerance, I will now talk to you about the benefits of going gluten-free. So obviously the benefits of going gluten-free are if you have celiac disease or gluten intolerance, you no longer have the negative effects that gluten has on your body. Some studies have shown that a gluten-free diet can help improve behavior in children on the autism spectrum. It can relieve symptoms of irritable bowel syndrome. It helps people eat healthier overall. If you're cutting out foods like pasta and bread, you're most likely eating in its place whole grains like corn or quinoa, or whole foods like fruits, veggies, lean meats, grains, to name a few. So, in conclusion, today we talked about cutting gluten out of your diet can be beneficial even if you don't have celiac disease. I've shared with you what gluten is, celiac disease, and gluten intolerance, and the benefits of going gluten-free. I hope you all learned that a gluten-free diet is more than a fad diet. It improves the quality of life for many people. Thank you.